update regarding the coronavirus pandemic in Wisconsin. State officials are about to give us an update on the latest number of cases and more guidance on how to curb the spread. Let's join right now. This is Secretary Designee Andrea Palm. She is with the Department of Health Services.
We have evidence of community spread here in Wisconsin. Specifically, we have evidence of community spread in Milwaukee, Dane, and Kenosha counties. This means that there are people who have tested positive and have no exposures to a known case or did not travel to a location where there is known community transmission. Due to these two factors, community spread and our testing challenges, the governor has directed me to sign an order for a statewide moratorium on mass gatherings of 10 or more people to mitigate the spread of COVID-19, effective today at 5 p.m. The governor will talk more about this in his remarks. As we discussed yesterday, we must protect and ensure the capacity of our healthcare system. The steps we are taking today, prioritizing testing and enacting stronger social distancing, are necessary steps to do this. We know this will further disrupt your lives, but this is necessary to further stop the spread of COVID-19 and to protect the capacity of our healthcare system. Now is the time to make a plan to stay home. It is vital for everyone, but especially for people who are at high risk and vulnerable, like our older citizens and those with compromised immune systems. These are the people who have been most adversely affected by COVID-19, and these are the people and the reasons that we all need to take these actions and these recommendations very seriously. Please know the signs and symptoms of COVID-19. These include fever, cough, and shortness of breath. And these are important symptoms to understand when we talk about the prioritization of testing moving forward. If you have these symptoms, call your healthcare provider before you go to a clinic or a hospital. Calling first will further help us preserve the capacity of our healthcare system. I can't say thank you enough to our local and tribal officers who are our boots on the ground in dealing with this public health crisis. The steps we are taking are an unprecedented adjustment to your lives, your businesses, and your activities, but we need to do this to help mitigate the spread of COVID-19. Your efforts are appreciated. We will get through this. The governor and DHS will continue to provide timely and factual information as long as this health crisis continues. Thank you so much. I'll now turn it over to the governor.
Thanks a lot, Andrea, for your good work, and good afternoon, and thank you all for joining us once again today. Obviously, it's St. Patrick's Day. We know this is a day many Wisconsinites like to celebrate, and while it's different this year, enjoy the day with your health and safety and the health and safety of the community in mind. With that said, I want to talk a little bit about the state's new directives around social distancing today, as well as an update on some of the other measures the state has taken to help the people of Wisconsin. As Secretary Palm mentioned, I directed her to order a statewide moratorium on mass gatherings of 10 people or more to slow the spread of COVID-19. This order does make exceptions for some critical functions, including transportation, childcare, hotel, military, law enforcement, food pantries, hospitals, long-term care facilities, utility facilities, job centers, and courts. In addition, as of 5 p.m. today, all bars will be closed in the state and restaurants will be closed except for takeout and delivery. We are seeing community spread of COVID-19 in Wisconsin. This means that there are people who have tested positive who have had no exposures to a known case, nor did they travel to a location where there is known community spread. Today we have cases in Milwaukee, Dane, and Kenosha counties indicating that there is community spread happening in Wisconsin. Social distancing will help keep you and your family and our community from increased risk of exposure. What we're saying here, folks, is simply this: stay home if you can. There are workers on the front line who can't stay home. We need our healthcare workers, our direct care workers, first responders, military, and service workers to stay healthy so that they continue to keep us all safe. We also will be expanding the school closure order until further notice. Now, beyond the health concerns, we know that the outbreak of COVID-19 is causing considerable uncertainty for workers and businesses, not only in Wisconsin, but obviously across the globe. To help our workers, we are asking the state legislature to immediately take up legislation to repeal Wisconsin's 1-week waiting period for unemployment compensation insurance. In addition, I'll be talking tomorrow with leaders of the legislature about a legislative package. In addition, tomorrow we will issue an order that will waive work search requirements and modify the availability requirements for unemployment insurance benefits for workers impacted by COVID-19. It's incredibly important that the much needed unemployment insurance funds make it to affected workers quickly. This order will also waive the requirement that UI claimants who are impacted due to COVID-19 conduct at least 4 weekly work search actions. This ensures that claimants who are otherwise eligible but out of work due to COVID-19 are considered available for work and therefore available for benefits. This is in line with federal guidelines related to administering unemployment insurance benefits during the pandemic period and allows the program to support our workers who have been affected by COVID-19 outbreak. I have also called upon the Wisconsin Economic Development Corporation to work closely with Wisconsin Emergency Management and the U.S. Small Business Administration to unlock federal relief funds. The SBA is offering designated states and territories low interest, federal disaster loans for working capital to small businesses suffering substantial economic injury as a result of COVID-19. SBA's economic injury disaster loans offer up to $2 million per business in assistance and can provide vital economic support to small businesses to help overcome the temporary loss of revenue they're experiencing. Once the loan funding is unlocked, Wisconsin businesses will be able to access an online portal to apply for the economic injury disaster loans. Wisconsin Economic Development Corporation is also working to provide state-level assistance for local small businesses in the very near future. We also have important elections coming up, and it's imperative that our democracy continues. The good news is that Wisconsin makes it easy to request an absentee ballot. In fact, as of this morning, there are 500,000 absentee ballot requests pending. To help facilitate this influx of requests, I have directed state agencies to support the Wisconsin Election Commission in any way that they can. Finally, I want to talk to you about more ways that you can help and be good neighbors to one another. If you can keep your kids at home with you, please do so to ensure that child care is available to our frontline workers. Continue to wash your hands, clean surfaces, and cover your coughs and sneezes. Donate blood if you're able, and consider donations to food pantries and nonprofits to help folks in need. And right now, our supply chain at grocery stores is keeping up. But if folks continue to stockpile, then we will not be able to keep the shelves stocked. So the message is this: buy what you need, don't buy for a year's supply. So thank you very much for being part of this again today, and I'll turn it over to Dr. Westergaard.
Great. So I'm Dr. Bateman from the Wisconsin State Lab of Hygiene. I'll provide just a couple more details on the lab testing details. So we initially had a capacity of about 100 specimens that we could test a day, which was our normal capacity. We've since scaled up to be up to about 400 specimens per day. We've achieved this by extending hours of testing, and we plan to be testing for 7 days per week for the foreseeable future. This is our enhanced sustained capacity at this point of 400 a day. However, yesterday and today, the number of specimens that we've received has been substantially higher than this 400 mark. The PCR test that we use, that is the test that was developed at CDC, requires many different ingredients to produce a result. It's much more complex than a pregnancy test where one stick equals one result. So we have a decent number of supplies currently, but the supply chain right now is fragile because so many other labs nationwide are bringing on and scaling up this testing. This is a nationwide issue, not just Wisconsin. So to avoid depleting the supplies we currently have, we're working with our partners at DHS to prioritize the available tests. We've also been in daily contact with Wisconsin clinical laboratories located in hospitals to help them bring up testing in their own labs to increase statewide testing capacity. We've been contacting many supply manufacturers, are looking into additional manufacturers to further increase diversify our supply chain and increase our capacity. And we've also been in routine contact with the Association of Public Health Laboratories, which represents public health labs nationwide. We know that there is some frustration about testing issues nationwide. I do want to assure you that everyone at the state lab and our staff are working very long hours every day with our partners at DHS and others to do the best we can to serve the people of Wisconsin. Thank you.
Okay, thank you. And now we'll open it up to questions. A reminder to maintain quality audio, keep your phones on mute until it's time to ask your questions. If you can, use *6 to mute and unmute your phones. And we'll begin our questions this afternoon with Maddie Pine from the USA Today Network. Maddie?
Hi, thanks for taking the question. So I guess my first question would be, now that community spread is confirmed, what does that change in your approach, and what should it change in the public's approach of handling the virus, and how much easier?
Okay, we have been listening into what has been a daily briefing from the Department of Health Services on the situation of coronavirus here in Wisconsin. They are now, we are going to continue to monitor this to bring you any updates. But one of the big headlines coming out of this is that Governor Evers has now ordered that any gatherings of 10 or more that they'd be shut down, no longer. So that includes restaurants unless they have dine-out services. This means that bars will have to close. So that social distancing that we are talking about, the footprint around that continues to get smaller and smaller. It is now down to no more gatherings of 10 or more people. So we will continue to monitor this and all the other developments that are going on throughout the city, throughout the county, and throughout the state, and we will bring you the latest updates, definitely online, but the next time we'll see you, we'll be back here on TMJ4 News at 4. For now, we'll return you to regular programming.